Okay. So we have 12 body system. Okay. And we will go through one by one. So today I am just going to take the smaller one. Okay. So suppose you have drive a car or bike, both. Okay. So how many like parts in your car? Tires. Okay.
Doors, like
Door.
doors and
Boot space.
five seaters, five seats,
Mm.
uh, engine,
Engine, clutch, gear, brake, headlight, है ना? Indicators,
indicator,
all these are. So you are about the car. Okay. And you are, how old are you? 28 years. So even in fact, uh, you are driving car for the last couple of years, you know too many parts, है ना? But in your body, you are not aware about that, which organ you have in your body. Okay. So like you have aware about the parts of the car, similarly you need to aware about the organ in your body. Okay. Until unless you did not understand your organ system, then it will be difficult to identify the diseases, the procedures. Okay. So suppose when you go to the mechanic,
uh,
repair anything damage, है ना? And sometimes there is nothing, no problem, still you go for the service. है ना? Why you go for the service?
basic service, nothing, general service.
Okay.
Yeah, after traveling 10,000 kilometers, so we must
है ना?
travel.
So suppose every human being, है ना? Did they go to the physician for the just annual checkup? No. Used to, but normally people did not go to the physician. But it's very important because if you are much worry about your car, then you should more worry about your body. है ना? Because there may be problem which are going through, but if you did not go to the physician, you are not aware about. So screening is very important these days. Okay. So our first body system is integumentary system. Okay. Integumentary means skin. So today we will, so skin is the largest part in the human body. Okay. You can see that skin is everywhere on our body. So skin is the largest part in our body. So there are three parts of the skin. Okay. First is epidermis. So three layers are there. The first layer is epidermis. Okay. If you see your skin, this is epidermis. Af top layer. After that, you have dermis, second layer. Second layer. And the third layer is subcutaneous. 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 क्योंकि cutaneous means is also skin. And sub is under. जैसे if you are walking on the road, then we say way. I am on the way. है ना?
Yes.
But if you want to cross one side to the other side, there are three ways. Either on the way, like we have zebra crossing, or we have a foot over bridge, and the third one is subway, because that way is under the way. है ना? So if your skin is cutaneous and subcutaneous is below that skin, है ना? So there are three parts of the skin. Okay, epidermis, dermis, and subcutaneous. Epidermis is the upper layer, middle layer, and inner layer. Okay. After that, the muscles is there. है ना?
Muscles.
No, no, muscles. Then we have bones. Then we have bone marrow. Okay. Fascia is also there. So you can remember three layers: epidermis, dermis, and subcutaneous. Then we have two glands also: sebaceous gland and sweat gland. Okay. Sebaceous gland is like some people have oily skin and some people have dry skin. है ना? So the oil secreting gland is sebaceous gland. And you are sweating, then you have a sweat gland. Dogs do not have sweat glands. If they have like they feel hot, they just lava secretion is there, है ना? To cool down their body part. Okay. So we have two glands and three layers. Okay. Then we have nails also. That is also part of your skin. So if you can see this image, so nail we call nail plate. Okay. So this is nail plate. Nail plate. So there is a tree. है ना? So the part underneath the earth, what we call root. Roots, na? So the part of the nail inside your skin, that's called either nail root or nail matrix. You see the image? Okay. है ना? So this is nail root, from where the nail originate. Okay. You can say nail matrix or you can say nail root. And the upper part of that skin is called cuticle. है ना? So you have nail plate, you have nail root, you have or nail matrix, and we have nail bed. You sleep on bed, so the nail is also on bed. That's called nail bed. है ना? The nail bed, nail matrix, cuticle. Okay. Then you also have a half moon shape. है ना? That is lunula. This one. Every person have. You can see your nail. Yeah, half moon will be there. This one, half moon. है ना? So this is lunula. हाँ, lunula. Okay. So what we need to learn again and again, we have three layers of skin: epidermis, dermis, subcutaneous. We have two glands: sebaceous gland and sweat gland. Then we have nail. है ना? So what is the word root of nail? Onaico. 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 ONCHYO. Onaico. है ना? And what is the word root for skin? Word root. Word root for skin? Cutano or dermato? Dermatologist, skin specialist. Cutano is also skin, subcutaneous, under the skin. Okay, so once we are go through the anatomy, okay, why we will go to the physician? We have any disease in skin, है ना? When we will go to the this dermatologist, if somebody have any skin problems, है ना? So now the second part, we will always learn three things in anatomy. One is the medical terms. The second one is diseases. And the third one, we will learn this procedures. Okay. So here are skin lesions. Okay. So disease of skin, है ना? So these are the common diagnosis. Okay. Bulla, macule, nodule, patch. So physician mentioned these in medical record. Then we have papule, plaque, pustule, vesicle, wheal, scale, crust, fissure. Then we have excoriation, erosion, है ना? Scar. So these are the common diagnoses. Okay. But these are only skin lesion, not the complete diagnosis of the skin. Yeah, common lesions. Then we have some more diagnosis, singlies, which we called herpes zoster. It's very painful, है ना? Hives, we have urticaria. So most of the time, this question also came in your examination. Hives one. Then we have psoriasis, redness of the skin, eczema, rosacea, Okay, so what you need to learn rather than like going into a very deep study, you can just remember the name, है ना? And it's easy to learn from the images, है ना? If you go through in the deep, then it will be there are okay. I will give you the one most common thing. Our human brain is a CPU, or you can say hard disk,
Yes.
है ना? So suppose which phone you carry? Realme. And how much the hard disk?
It's the 128 GB.
128 GB. So can you store 150 GB data in this?
Yes, sir.
You can store?
You can store 150 GB. Oh, no, sir.
You cannot store.
Yeah, I can.
You can maximum store 128 GB data. Similarly, in our brain, there is a hard disk.
Yeah.
You can store a limited amount of data over there.
Yes, sir.
To keep more data, you need to remove the previous one.
Yes.
Okay. So today, if you learn something, so there is a space, you remember thing. है ना? Again, tomorrow you will learn something.
Yeah.
But there will a time come, then you will, until unless your memory will not release or delete some previous data, then it's very difficult to learn the new things. Okay. So that's why it's depend on you how much information you want to store. There may be 4 or 5 pages you will found on single disease, but that may be a like the data which you don't want to store. है ना? So it's very important that what keep in our mind and what we need to remove from our mind. है ना? Then we have skin tags, okay, acne, athlete's foot. Then we have moles, warts, seborrheic keratosis. Okay. Then we have pressure ulcer. So what is pressure ulcer? Pressure ulcer is also known as the decubitus ulcer. So when you buy a new shoes or new sleepers, so most of the time you get ulcers. Your skin peel out.
Yes.
है ना? So that's called pressure ulcer. Something put pressure and there is a ulcer. Okay. So there are multiple stages of pressure ulcer. Stage 1, 2, 3, 4. Okay. In first stage, only epidermis get involved. Okay.
Top layer.
Top layer. That is first stage. Maybe healed very frequently. है ना?
Yes, sir.
Then we have second level of skin involved. That is dermis. More problem. More time to heal. Then we have stage 3. It reach up to subcutaneous level.
It means fat. Fat also is there.
Huh. And then there is in stage 4, there is a bone involvement. है ना? So these are the, either we call them the pressure ulcer or the decubitus ulcer.
That means while wearing a new boots.
It's not a while if you lay down on bed for multiple days, then you will also get the bed sores. That is also called pressure ulcer. Yeah. Then we have clinical procedures. Okay. So the clinical procedure I have not included here. Okay. But the common clinical procedure on skin level perform incision and drainage. So what is incision and drainage? Incision means cut. Physician make a cut. Okay. So if there is a fluid collection, he will make a cut and the fluid will be drained. Okay. I will show you. This. Check this. There is a fluid collection. The physician is making a cut. First, he is giving the anesthesia. है ना? Then he is making a cut है ना?
Yes.
Then he will remove the debris. Okay. And the best part to learn any procedure, always type animation video.
In this demonstration, I'm going to talk about a couple of different.
The real image will not give you the real procedure will not give you the exact data. So he mark the things. He's giving the anesthesia.
Yes.
This is the procedure you will get this kind of reports in medical coding. Now he's making the incision. So that is incision and the pus will be drained out. The procedure name is incision and drainage. Okay. Now another procedure is puncture aspiration. So what is in puncture aspiration?
Uh,
No. The puncture aspiration is rather than making an incision, he just put the needle over there
okay.
and a syringe. From syringe, he will aspirate. Aspiration means sucking the material.
Yes.
Okay.
Okay.
So there is a difference.
Instead of cutting, he use syringe.
Syringe. Like this. He puncture from the needle and aspirate. Okay.
Okay.
So he will not cut.
Yeah.
He is doing the aspiration. No?
Yes.
Then we have debridement. What is debridement? Debridement is, have you seen that so many girls, they are just debriding their nails.
Yeah.
That's called nail filing. But actually it's a debridement. They are smoothing the edges of the nails. But it cannot only with the nail, it can be on the epidermis, it can be on the dermis, muscle, fascia, or even on the bone also. Okay. So debridement is smoothing of the edges. Okay. If there is a rough area, then what physician will do? He will do the debridement. Okay. Then we have biopsy. Biopsy. So in biopsy, they take a smaller piece of any body part. So right now we are discussing the integumentary system. So they will take the skin part. Otherwise, he can take biopsy from the liver, he can biopsy from the lung, from the bone, from the kidney, anywhere he can take the biopsy. And there are multiple ways to take the biopsy. He can take the biopsy via needle. He can take biopsy via open surgery, है ना? And he can take biopsy from scopy also, bronchoscope, arthroscope, है ना? Or laryngoscope, laparoscopy. So any scopy he can take the biopsy. Okay. Then we have excision. What is excision? If patient have any like lesion, it can be cancerous also. So he need to remove that particular area. Okay, so that's called excision. Excision can be benign or malignant. So benign is normal lesion, and malignant means cancerous. Yeah, cancer is always malignant. So whenever there is either cancer mention or malignant mention, that lesion is cancer. And cancer can be happen in any body part. Okay, it can be in bone, it can be in lung, liver, है ना? any body part. Then we have repair. So if skin has been cut out, है ना,
Yes, sir.
then the physician need to stitch that,
Teachers.
है ना. Or if he's done any sort of surgery on abdominal area or any other area, he need to open that particular side and he also need to close that side. So that called repair. Okay. Then we have ATT. That called adjacent tissue transfer. So what is this adjacent tissue transfer? Ah, not organ transfer. He just suppose if he have a patient have wound on cheek, so he need to take close that wound. So he can take the adjacent area, the healthy tissue. That's called adjacent tissue transfer. Let me check if can get any video on adjacent tissue transfer.
To elongate this contracted scar, incision is made along it, then two 60-degree incisions are made. As the flaps are lifted up and transposed, what was originally the short axis of the scar has now been lengthened at the expense of a decrease in the width dimension.
So this is jetplasty.
To elongate this contracted scar, incision is made along it, then two 60-degree incisions are made. As the flaps are lifted up and transposed, what was originally the short axis of the scar has now been lengthened at the expense of a decrease in the width dimension.
Okay. So this is jetplasty. So there are multiple name of ATT, jetplasty, W-plasty, VY-plasty. So there are multiple name of the ATT.
Plastic surgery.
Not exact plastic surgery. Yes, but kind of plastic surgery. It's a different surgery, it's not ATT. You know?
Yes.
So adjacent tissue transfer is there. Then we have skin graft. So there are three types of skin graft.
Yes.
Autograft. Then we have allograft. Then we have xenograft. Autograft is the skin taken from own body. If a patient have any defect and physician want to put the skin graft, auto skin graft, then he need to take the skin from the other part. Allograft means he will take skin from the other person, but the same human being. And xenograft is other human being, other than human being. He may be take from the god, from the horse, है ना? from any animals he can take. So auto is self, allo is other, and geno is other species,
Other human beings.
other than the human being. So skin graft is there. Then we have more microscopic surgery. Yeah, more microscopic. Normally, it the surgery has been done when the patient has skin cancer. So in more microscopic, they block the cancerous cells. Okay. When we go through the CPT part, we will go in little bit detail. But right now, our motive is that you should be aware about that these kind of surgeries are there. Okay. Most microscopic surgery is there. Then we have skin tag removal. So skin tags are look like this,
Uh,
these kind of
yes, sir. Big ground.
yeah images. These it can be happen on your armpit, है ना, your
Yes.
face, your hand,
Yes.
है ना, anywhere it can be. So skin tag removal. Then we have acne surgery. What is acne? In India, we will say pimples.
Pimples.
Yeah.
Yeah.
But in US, they don't say the pimples, they say acne. Yeah. Normally, they destroy the acne with the liquid nitrogen.
Liquid.
Liquid nitrogen. Then foreign body removal. If a person is walking in the park, then there is so in or glass particle in his body, then they
Yeah.
went to the physician, then he will remove the foreign body, but he will charge, na? So that again fall in the procedure. Foreign body removal. Then we have skin graft, we already cover. What other procedures we have in integumentary system? These are the common procedures. Any query question in integumentary system?
No, sir.
No. So once you go through these, hmm. So the trick to learn all these things, the more you write on your copy and pen,
Yes.
use your copy and your pen, then the more thing you will remember. You can watch videos, you can go through the PPT multiple times, then it will be easier for you. Okay, so this is the first body system, which is integumentary, and it's a very small system. So not very big system.
Yes, sir.